Hello to you all. I'm Michelle Fox with DentistryIQ.com. This week we'll be talking with Dr. Little about the technology used in successful implant cases. We'll also chat with Judy Kay about the best way for a doctor to handle an office full of drama. Finally, we interviewed a longtime writer for RDH Magazine, Kathy Seckman, who just published her first novel. Kevin Henry, managing editor of Dental Economics, recently had a chance to sit down with Dr. David Little, one of the nation's top speakers on the subject of implants. Kevin talked to Dr. Little specifically about the technology used in successful implant cases.
Hi, Kevin Henry of Dental Economics Magazine, here today in our home city of Tulsa, Oklahoma, talking to Dr. David Little from San Antonio. And we're going to talk a little bit today about implants, but really a lot of the technology that is surrounding implants right now. So first of all, thanks for joining me. I appreciate it.
Glad to be here.
Tell me a little bit about what you're seeing as far as the technology that dentists are using to go along with implants right now.
Well, it's really exciting with the implant dentistry now is because we can actually now kind of visualize the result before we start, really see the end before we start. And that's because of technology allowing us to plan the restoration and then go backwards with the placement.
Okay.
Obviously, CBCT technology, using simulation software where we can actually virtually place the implant and make sure that the implant's in the right place. And that makes a big difference in the final restorative outcome. And of course, the happy patient, that's what we're looking for.
Absolutely. Do you feel like the technology today is really raising that standard of care that all dentists are supposed to really subscribe to?
Absolutely it does, because it takes all the guesswork out of it.
Okay.
And it also gives us confidence to know exactly what we're going to see at the end, because nobody wants surprises. And even in like edentalism, there are so many patients out there that are just, they can only eat what they we eat what they can instead of really being able to eat what they want. And being able to go in and place artificial roots in there and have them function, it's just, that's one of those rewarding things we do in dentistry today.
You know, a lot of times I know dentists look at the price tag for a cone beam and they immediately go, and they back off. What would you say to those dentists regarding CBCT and implants?
Yeah, very good question. And just because you don't have it in your office doesn't mean you can't use the technology today.
Okay.
That can very easily be outsourced. And so you can get that done at a reasonable fee, and you can even outsource the reading of it, you can outsource the planning of it, and so you get back everything you need for the final result. And you can also, during that process, get input from the laboratory and the manufacturers so that you can make sure what your costs are going to be before you quote a fee, which is a good way to do it.
Always, absolutely.
Yeah.
Last question for you. What's really maybe one question that you hear a lot after you get some implant courses, maybe a tip or a mistake that you hear people often make? What's one suggestion you might do?
You know, one of the things, and you wouldn't think it, but one of the things that happens a lot is leaving cement behind after putting a restoration in. And that's something that we really have to be cautious of. And one of the techniques that I usually tell people is to either use an analog or make a customized abutment with some bite registration material and actually cement it on that first and wipe off the excess. Then when you place it in, you just have a thin lining that seals it, and that has less chance of getting that cement to cause problems, because peri-implantitis can be a problem with implant dentistry. And that's something that we really eliminated by doing some of those things.
Great. All right. Hey, Dr. Little, thanks for your time. I really appreciate it.
Thank you. Thanks. Appreciate it. Thanks.
Thank you for that, Kevin, and thank you, Dr. Little. Judy Kay Mazoff, or as we know her, Judy Kay, is a popular speaker and author of Rise and Shine, An Evolutionary Journey to Get Out of Your Way and On Your Way to Success. She recently was a guest speaker at the 7th Annual Dental Office Managers Conference in Nashville earlier this month. Kevin Henry, who just published an article titled 7 Steps to a Drama-Free Office in Dental Assisting Digest, asked Judy for her opinion for reducing the drama among employees in the dental office.
So Judy Kay, if a dentist is involved with a practice full of drama, what should he or she do?
I think they need to address the drama, bring whoever are the participants in the drama into their office and sit down and talk with them and talk about what it is that is going on, explain to them what your expectations are as a leader, explain that it's not important that they don't have to love each other, they just have to respect each other and work together, and set parameters, and then actually ask them if they're able to do it. Because if they aren't, this is an employee that's going to create drama for the rest of your working relationship, so then it's time for them to move on.
Once again, thank you, Kevin, and thank you, Judy Kay. Kathy Seckman is a dental hygienist who has written dozens of articles for RDH Magazine over the past 20 years. Kathy recently published her first novel, Weirdo World, which is about a young man's travel back in time to the year 1963. Kathy describes the central character's dilemma in an interview with RDH editor Mark Hartley.
The story is about Hunter playing with an antique time clock, and he punches his card into the time clock at the same time lightning hits it. It's the middle of a thunderstorm, and he wakes up in 1963, where the boys love Tarzan, and they watch the movies every Saturday afternoon on TV. And he makes friends. They hide him in their treehouse, and they spend the course of the book trying to get Hunter back home. And they eventually ask one of the fathers for help, and he figures it out, and Hunter gets home in the end. And I have the cover. I don't have the book yet, but here's the cover right there.
Definitely excited. The Ohio dental hygienist is naturally excited about the publication of her first novel, and we asked her what her future plans are.
Oh, more novels.
More novels.
When I started out thinking that I liked to write, I wanted to write novels. And I've written 4 or 5, but I could never get anyone to buy them. And I discovered I could make money with nonfiction writing, so I went with that. But I still would love to just sit in my den every day and write novels.
Kathy also promised Mark that the novel has a bang-up ending, as she describes here.
Without giving away the ending, is there anything you can tell us about what it's like to come back from 1963 to 2011?
He feels out of place, out of touch, disconnected, and he realizes that no one believes him, but it's got a bang-up ending.
Okay, well, good. You want to hold up the book cover again? And
Yes.
And you said this book is released on in
Mid-Sep-
middle of September?
Mm-hmm. And it's Cool Well Press, and I think that it could be on bookshelves as a paperback, but that's not finalized yet. All I know for sure is that it'll be available on Amazon and on the Cool Well website.
Thank you, Mark, and thank you, Kathy. That's awesome. And thank you so much for joining us on dentistryIQ.com. I'm Michelle Fox, saying goodbye until next week.